COPD in a minute. Definition of COPD: persistent respiratory symptoms and airflow limitation. It is partially reversible. That sentence is very important, partially reversible. Chronic exposure to smoke and inflammatory cell-mediated destruction are the hallmark of pathogenesis of COPD. Pathophysiologically, there is airflow obstruction, hyperinflation and impaired gas exchange. Airflow obstruction, hyperinflation and impaired gas exchange. Risk factors: smoking, infection, passive smoking, air pollution and genetic. Clinically, cough, expectoration, dyspnea on exertion, decreased FeV1 by FVC. FeV1 by FVC less than 70% is a hallmark of COPD. Treatment: oral treatments available are theophylline, steroids, phosphodiesterase 4 inhibitor or roflumilast. Antibiotics: inhalation beta agonist, antimuscarinics, steroids. Non-pharmacological treatment: pulmonary rehabilitation, surgery. Pulmonary rehabilitation is exercise and training the patient for breathing exercise and all. Surgery: lung volume reduction and lung transplantation. Prevention of COPD by smoking cessation and prevent exacerbations by vaccine and proper use of drugs. So that finishes COPD in a minute.